So this is a case that we set up for restorative with crown lengthening and veneers. All right, so the patient's chief complaint was that she pretty much hates everything about her teeth, how crooked they are, how yellow they are. We can see that she has quite a deep bite, about 100% deep bite. On her left side, she is in a class 2 molar canine, and on her right side, she has the upper first molar that has had an endo done, and then it was taken out of occlusion, and that tooth is now super erupted into full occlusion. So our treatment and recommendations is aligner therapy followed by crown lengthening and restorative. We left the wisdom teeth in place due to the proximity with the nerve. Lots of previous endos and heavy restorative. In terms of her facial balance, she has a pretty prominent nose and chin. But I think that in terms of what we're looking to do, we can make a big difference in terms of her face. All right, clinical goals. So we want to correct the deep bite by extensively intruding those teeth. By allowing there to be some spaces that are going to open up, it's going to allow the aligners to grip better and have better control of the root tip, as well as, like you'd mentioned before, those oblique attachments are allowing us to put mesial root tip onto the upper right central and distal root tip into the upper left central. So huge overcorrection there. And we want to intrude the upper first molar, the 1/6, for a future crown. So we're going to go ahead and make sure that we have good retention on the neighboring teeth, on the 1/6 and the 1/7 and the 1/5, or the upper first, second, or the upper second molar and the upper second premolar. And we actually overcorrected that a little bit more. We'll see that later, how we actually did more than we really needed. We, of course, want to level our gingival margins for the restorative. And we want to sequentially distalize into a proper class 1. So second molar, first molar, premolars, canine, as we sequentially distalize. Okay, so at progress, what we can see is we've corrected the deep bite really nicely. We could have actually had more distal root tip on the upper left central to balance that out a little bit more, but the gingival margins look much, much better. We rounded out the arch on the maxillary arch, and on the mandibular arch corrected the crowding, but still more to go. Corrected to a class 1 occlusion on the left-hand side there. And we've intruded that upper first molar to the point that there's now tons of room for restorative. And the gingival margins are pretty much even. So our next batch of aligners, we're going to continue some intrusion here. Just setting things up for the crown lengthening and restorative. So this is what she looks like after the crown lengthening. I think that the 2-2 or the upper left lateral could have had a little bit more intrusion into it. It's just tricky because it's such a small tooth to get a grip on. Nice distalization into a proper class 1 on the patient's left side. Deep bite correction looks good. And now this was the same clean check. All right, so this is where we finish the case. So on the left-hand side, this is pre-restorative. On the right, that's post-restorative. Let's take a look at our pre-restorative. So you can see here that she did have a small filling done in between the central incisors. So we kind of corrected the position to account for that filling so that when the restorative was done, the midlines would be on. The restorative dentist did do some crown lengthening on that 2-2 at the time of the restorations. We didn't go further with this one because the patient's wedding was coming up, and so we didn't have time to keep going. So we did have to accept a little bit of a compromise, but she was obviously super happy. We let that tooth relapse a little bit, that upper first molar, because we had actually over-intruded it, so the dentist asked me to put it back down. And this is how she looks after her restorations. So my critique is looking at that upper lateral incisor, the left. The root still goes too far to the palatal. I would have liked to have more buccal root torque on that tooth, and then it would have been more symmetrical to the 1, 2, or the upper right lateral. But midlines look great. Nice occlusion. And yeah, there's our class 1, and then she'll get that crown done at a later time still. So one thing that I did actually plan into her retention is, instead of giving her Viveras, I got some passive trays, and I put some attachments on the occlusal of that 1/6. So it's just like 2 4mm horizontal, or not horizontal, but 2 4mm attachments that go on the occlusal aspect of her upper tray. So then whenever she's wearing her passive trays as retainers, she'll bite down and the tray will hit where those fake attachments sit on the occlusal of the 1/6, or the upper first molar, and that prevents that tooth from being able to erupt further. The alternative was just to leave 2 attachments on those teeth, just so that tooth can't erupt on the 1/5 and the 1/7, or the upper second premolar and the upper second molar. And then we saw her 16 times over 18 months.